боловсролтой арчлалын хөгжлийн зарчим нь төрийн засаглалыг хэрэгжүүлэхэд ард түмний нэрээ тэгш эрхтэйгээс оролцохоос үүдэн төрийн ард түмний эрх чөлөө үзэл бодол өмч хөрөнгийг хамгаалахад оршино. Үүлийн дороо чөлөө зах зээлийн өрсөлд донт нийгэмд хүн бүр тэгш эрхтэйгээр оролцож буруу татуу зөвд зөөлөн зарчмаар ардчилсан хуулийн засаглал тогтож байна. Улс төрчдөөс амьдралын хамааралтай нэг иргэдийн хонсор сэтгэлдээ 200 жилийн өмнө орхигдож байна. Үүнээс харахад үлсэж байсан ч үзэл бодлоо худалдах байх ухаарлыг олж авах нь чухал юм. Америкийн Нэгдсэн Улсын түүхэн хөгжил учирсан саад бэрхшээлийг яаж хэрхэн даван туулж дэлхийн топ улс болж чадсан цуврал нэвтрүүлэг удахгүй та бүхэн төрөв.
Good morning, Dr. Sham Bрэди. Please introduce yourself. What's your position in medical care?
Thank you for inviting me. My name is Marie Shaum Bрэdi. I'm a general practitioner here in Arlington, Virginia. I take care of people from childhood, from birth, so from babies to old people. My job is to keep them out of the hospital and to keep them healthy so that they don't need medical care. That's my goal. Well, my position in medical care is that I've trained in conventional Western medicine, but I think that there are some holes in that training, and I think that if we look at the history of human beings, people lived a long time without Western medicine, and that what sustained them was a good diet. And so that Western medicine doesn't concentrate much on diet, and I try to do that. So our motto in our office is we try to fix it with food.
All right.
First we try to fix it with food and water, and then we use supplements if we have to, and we will absolutely use prescriptions if we need to.
Okay, thank you. We are researching COVID-19. Can you tell me about COVID-19 and what's your experience with this virus?
So my experience with this virus is that I've had limited ability to test for it in the community, but I will test for it with any symptoms, because I think we should all test a lot for this infection to find out how prevalent it is in the community. So of the 30 people I've tested in my practice who have had some sort of symptoms that could be attributed to COVID-19, I have had 6 positive patients. And of those 6, only 1 has ended up in the hospital. So my job is to identify the disease, to take care of the disease, to keep it at a low enough level that they don't end up in the hospital and they don't end up on a ventilator.
Okay. What do you think is the reason why we have a lot of spreading in U.S.?
Well, I think what we hear on the news is accurate.
Right.
I think that we didn't understand that the virus came much earlier than we think it did, and so that we didn't respond quickly enough because we didn't understand. So by the time we began to understand it, it was already here and spreading, and so we don't have a treatment for this viral disease, and we don't have any vaccines, and they're working very hard on that. But from a general practitioner's perspective, I need to keep my patients healthy in case they get the virus. I can't protect them from getting the virus because I can't protect them from who they come in contact with. But I can try to fill them up with the good things that they need, so in case they get the virus, they will be able to handle it. So to answer your question on why is there so much spreading in the United States, my opinion, and only my opinion,
Sure.
is that Americans don't know how to eat anymore. Right. And that because we don't understand what the purpose of food is anymore, we eat a lot of stuff that is not nutritional, will not feed us, and will not fill us up with the nutrients that we need to protect ourselves from this virus when we get it, because many of us are going to get the virus. It's a matter of how we handle it.
Okay. How long COVID-19 will last, and what should people be concerned?
Well, it's going to last as long as it takes for us to reach a level of herd immunity or to get a vaccine. And herd immunity, I've heard, is a certain number of us have to have the disease, have to have immunity to the disease or have survived the disease in order to protect the other ones in the community who have not had it. And I've heard the percentage anywhere from 50% of our population to 70% have to have that. So how long it takes us to get there will depend on how smart we are. But in this country, medicine doesn't concentrate much on nutrition, so I think it's going to take the United States a lot longer than other countries.
What is your main treatment for this virus?
Well, we all know there is no treatment for the virus.
Right.
So the first thing to do is to identify it, so you need to diagnose it. So we need better testing in this country. And we're working on that. But the next thing is to be able to handle it when you come across the infection. And so my job is to fill up my patients with as many good ingredients that will give them the ability to fight the infection when they encounter it, so that they either have no symptoms or they're able to survive the symptoms that they get.
Okay. How effective and important is nutritional healing on COVID-19?
Well, that is not really discussed in this country,
Okay.
But I think it's absolutely essential. And so what I do with my own patients is I concentrate on nutrition, even long before COVID came around. My emphasis is to stay healthy by eating healthy. And so if I can get the people in this country, in my practice, to eat a healthier diet, they will have the resources, so when they come across this virus, they will be able to handle it better.
One of the unique treatment COVID-19 is nutritional healing.
Yes.
All right. Can you explain?
Well, I have, since January, I've given my patients a sheet on how to improve their immune system.
Okay.
And even before COVID-19 was around, I would tell my patients in the fall, I would challenge them and say, let's see if we can get you all the way through the winter without getting a cold or a flu. Let's see if we can stay healthy by eating healthy and getting enough sleep and getting enough good exercise. And if you do get sick, if you're filled with good nutrition, then you should be able to handle the disease faster and at a less serious level. So towards that goal, I've asked my patients to eat, to really concentrate on their diet, 6 different vegetables every day, 4 different fruits every day, good protein and good fats, and to try to stay away from most American junk food. In this area, we have a lot of different nationalities who have come here. And so many of my patients are from all over the world. And my most important advice to them, especially the immigrants, is to not eat like an American. Because most people coming from other areas of the world understand that nutrition, what we feed ourselves, is what keeps our bodies healthy. And in the United States, we seem to have forgotten the purpose of good food.
Good answers. Thank you so much.